how can I make my private practice more friendly, especially if I don't work in sexual health, but I am a medical care professional? For example, if I'm a dentist, how should I actually make my clinic more LGBTQ friendly? This is such a wonderful question, and I really applaud all the medical professionals who really take the time to approach someone like me and ask for consultancies in their clinics or in their hospitals, because this is a true form of allyship in one way with the community. So let's like dig into what that could look like. So if you're a dentist, you're probably really well placed to diagnose oral health issues that happen because of sexual health issues. So HIV, HPV, syphilis, all these can be diagnosed in the mouth, and what better way to do it rather than in the clinic? And a lot of patients don't know this, that going to a dentist can actually really help us to figure out sexual health issues as well. Number two, clinical intake forms. We all have private practices where we ask patients or clients to fill in basic information about themselves: name, age, gender, pronouns. Consider, if you are a dentist in your clinic that's doing these participatory intake forms, consider adding more than male and female in the gender category. Consider adding transgender, consider adding non-binary, gender non-conforming, any kind of category that makes your practice more inclusive and gives the message that you are aware that there are more than two genders, and that all people identifying across the gender spectrum are more than welcome in your clinic. Number three, reach out. As medical professionals, sometimes people have an ego. We get quite stuck in just saying, like, I don't need to advertise, I don't need to reach out. If someone needs to reach out to me, they know where I am. I have these many years of practice, I have a board outside my clinic, and they can just come, right? However, a lot of transgender, lesbian, bisexual, gay, queer people face so much stigma, especially in places where it's not very welcome, society is not very welcome to who you are, that going to a specific doctor and opening up about just even your mouth and all the things that are happening within your mouth can be very shame inducing. So instead of them having to go through a checklist of like, who is a queer professional that will accept me, or who is a queer ally that will accept me, consider reaching out to LGBTQ community organized groups, to like local meetups, to just on Instagram. Make sure that you are saying that you're queer friendly, and just overall saying that, this is something that you really advocate for and you proudly support. Number three, acknowledge gender neutral parents or LGBTQI parents. So this is something that gets under talked about, but in your medical forms, when you are looking at children and when you are asking, minors to come in, we don't know actually like whether they have a mom and a dad, whether they have a mom and a mom, whether they have a dad and a dad. And we often assume that it's a mom and that they are in a straight heterosexual relationship, but actually people have many kinds of caregivers. Even if someone is not out explicitly, especially in a country where this is not supported, we don't know what's happening behind closed doors. So instead of using gendered language like mother and father, consider putting in your form caregiver, primary caregiver, parent, spouse. Language that is not gendered will really help to make it more queer affirmative. Really importantly, share your knowledge with your patients, with your clients, with people who come to your clinic. So a lot of new studies are talking about how queer people and LGBTQ communities are more at risk for smoking and substance abuse because of high rates of depression and anxiety and loneliness. A lot of queer people, very young, take to substances to soothe anxiety, right? Now this can have direct impact on dental health. And as a dentist, you may really benefit knowing the link between this, which is often missed. So having, printouts of studies out there, having queer magazines out there, and sharing such information with your patients also makes it seem that you're less shame inducing and you're more like aware of what goes on in queer communities in general in that particular area, and you might be able to help them beyond just the obvious sexual health risk and associated with oral health. Just don't forget, these are people who are probably very ashamed. We are people who are really scared about harm that might happen to us if we tell you what we really do in our everyday lives and who we really date. Just simple things like whose hand we choose to hold, who we sleep with, just simple things that you as a non-queer professional may take for granted. Just remember that it is as simple and small as that. So there may be high rates of anxiety within your LGBTQ patients. So anything that you do, get to be soothing, non-judgmental, open, shame reducing, can actually have a direct impact to not only the community but also your practice. You probably will have more patients who will come to you because you seem to be more inclusive of just a wide variety of people. Good luck making your practice, your dentistry practice, more LGBTQ friendly. I will share more. Some of the research is from an article on nature.com. Some of them are from journals of schools and queer affirmative practices of businesses to basically make themselves more LGBTQ friendly. But most importantly, this is a shout out to my chosen family member, somebody I know for a very long time who's a dentist, who took the initiative of contacting me and asking me to make a video like this. Thank you so much. Bye.